The 2023 European Society of Hypertension, ESH, defines hypertension based on repeated office systolic blood pressure values more than 140 and/or diastolic blood pressure values more than 90. The ESH acknowledges a continuous relationship between blood pressure and cardiovascular or renal morbidity or fatal events, starting from an office systolic blood pressure more than 115 and diastolic blood pressure more than 75. However, this society definition does not consider its own recommendation to initiate drug treatment for patients aged 80 or older with systolic blood pressure of 160. They remark that the definition of hypertension remains unchanged from the 2018 guidelines. Let me involve this document in the discussion. This document states two important points. First one, hypertension is defined as the level of BP, blood pressure, at which the benefits of treatment, either with lifestyle intervention or drugs, unequivocally overweight the risk of treatment as documented by clinical trials. And second point, hypertension is defined as office systolic blood pressure values of at least 140 and/or diastolic blood pressure values of at least 90. The second point serves as the basis for the hypertension definition in the 2023 guidelines. The conclusion of the 2023 guidelines, which suggests that adverse events can start from an office systolic blood pressure more than 115 and diastolic blood pressure more than 75, along with the recommendation to initiate drug treatment at 160 for the elderly, and the conclusion of the 2018 guidelines in their first point that hypertension is defined as the level of blood pressure at which the benefits of treatment unequally outweigh the risk of treatment, shows that defining hypertension as of office systolic blood pressure values of at least 140 and of diastolic blood pressure values of at least 90 is incorrect. This approach assumes that lowering an individual elevated blood pressure to match the population norm is the appropriate course of action, disregarding the possibility that the specific person's normal blood pressure data may actually reside at the extreme ends of distribution for that statistical norm. In reality, there should be a set of blood pressure thresholds for different ages, sexes, body compositions, body mass index, etc. During my medical school training, I was taught that the lowest threshold for systolic blood pressure is 100 plus H in years, and for diastolic blood pressure it should be at least 90. Of course, this approach does not consider all the factors mentioned, but in my opinion, it is much better than the approach proposed by the guidelines. In reality, each individual is unique, and the best way to differentiate between normal and increased blood pressure is to establish norms based on long-term observations of each person. Physicians who adopt this approach can understand the normal levels of blood pressure for each patient and identify those that indicate hypertension. Thanks for likes and sharing.